everyone. Ann Louise here, your host for the First Lady of Nutrition podcast. And as you know, I tackle the most urgent, the most controversial health trends, and we challenge conventional medicine on every topic under the sun. And today it'll be no different. Today, my guest is Dr. Robyn Benson, and she is an extraordinary lady who's become a very dear friend. And she's also the regeneration medicine specialist I wish I knew way back when. Robyn, how did you get involved with nutrition and health and regeneration? You are a rising star in the whole field of health and healing.
Thank you. 28 years now, but it started very early in life. I lost a brother when I was 5 years old. I was one of 5 kids at the time, and he was born with some birth defects, and he died at 6 months of age. And I remember the day of his funeral, my parents left with my older brother, left me back with my sisters, and I so much wanted to be there. And more than anything, just feeling the torment and the sadness in our family dynamic. I was just wishing I could have saved his life. And that was a catalyst for when I was in 5th grade. I spent the day with an internal medicine doctor, literally the whole day, right? Dr. Rainsfield. And he took me to 2 nursing homes, and I thought, oh my God, maybe I don't want to be a doctor, right? I walked in there, and the smell of the place and just looking at all the people, honestly, I just wanted to turn around, and I said, why are so many people here? And some of these younger people that don't even have gray hair. And he said, sadly, people have made really bad choices, in terms of their diet. I mean, not exercising. And that just, stayed in my head forever. Then we went to the emergency room, and, a young man came in, like 55 years old, who had a heart attack. And I thought, oh my God. So that just changed my life, my course of my life. Even at 15, I'm like, that was when I was 12, but I knew that I wanted to be a doctor. And then I lost a really close classmate who died of leukemia. And it was just so sad to see him go through chemotherapy and radiation and everything he went through, right? And I thought, oh, does it have to be like this? Is what could have saved his life. So those 3 events, that's where I am doing what I am, almost 3 decades later, and why I'm such a health detective, and I don't give up easily.
I love it. I love your passion. You're relentless, a relentless seeker of truth.
This is true.
But you also founded the Santa Fe Soul Center for Regenerative Medicine and Destination Regenerate. So tell me about what goes on in the Santa Fe Soul Center.
So we're going into our 16th year, built from the ground up. I mean, everything intentional, the walls, the floors, our intentions for this center. We had groundbreaking ceremonies. And when you walk in, it represents unity and diversity. So we practice as many ancient wisdom traditions, from Chinese medicine to Ayurvedic, a little bit of everything that I've learned through my travels around the world. I've been to over almost 80 countries. So we focus on brain and body regeneration. Sexual rejuvenation is a big part of the regenerative pathway. But our whole room devoted to brain and body regeneration is a lot of incredible health technologies.
Like
a hyperbaric oxygen chamber.
Wow.
Yes, we have a theta chamber that's really good for neuroplasticity, neuroregenesis. We want to help people with addictions, with patterns that are hardwired in the brain. So that's the purpose of that. We also have transient magnetic stimulation that we stack with a vibrational plate, and that's really good for down regulating the whole spiral of depression, and deactivating certain parts of the brain and activating other parts of the brain, so that people can get out of this vicious cycle of anxiety and depression. And then we also have lots of PMF, pulse electromagnetic field technology, exercise with oxygen, really, really important for our patients that are not just because they're at 7,000, 8,000 feet here in Santa Fe, but because they have autoimmune conditions and other issues that's affecting oxygen utilization. And that's really essential, right? For us to really get our energy back. Yeah. So that's what that room is dedicated to.
How do you know what somebody needs? I mean, you have the most unified yet diverse group of therapies from East and Western medicine that I've ever heard of. I mean, I've got to come and stay there for about 3 months
I look forward to that.
what I'm interested in doing. But
Yeah.
how do you know when somebody walks through the door, they think they may need PRP, but in fact they need some kind of ozone therapy? How do you know what somebody needs? Is there a testing procedure that you do when you get into Santa Fe Soul
Yeah.
Center?
We like for people to come in with as many lab, any lab work that they have. That's certainly helpful. We also have a biofeedback machine called the AO scan, the Alpha Mega scan from Russia, to really determine what's going on in the biofield, because sometimes that's way more important than what a lab
You
will.
are cutting edge. You are cutting edge. My
Thank
kind
you.
of gal.
Yeah. I have something called the Biomarker Blueprint Kit for people who are part of my Destination Regenerate, people who fly in from all over the country or even locally from Santa Fe, to really look at what's going on in the body. So that includes food sensitivity tests. I think that's really important. We do a 300-point questionnaire through biotics research to find out what are the alarm areas. Is it the digestive system? Is there inflammation in the body? So that's very helpful. We also like to, like I know you're a big proponent of this, but looking at parasites. Like if somebody really comes in with gut health, or people who truly care to live a regenerative lifestyle, not just to get a facelift or a sexual rejuvenation treatment, I really want to know the health of your gut, because that is so important. So if you're having, gas, bloating, you have erectile dysfunction, there could be some worms or other critters that are hanging out in your system that's undermining your health. So with all the regenerative medicine in the world, we can help you. But if there's still something that's festering, it's really important to address that root cause.
I love it. And how does Chinese medicine? You're an acupuncturist, am I correct?
Yep, Doctor of Oriental Medicine, and pulse diagnosis. It's fantastic. So I don't need to know a thing. I don't even have to look at someone's chart or their intake form. There's so much that I can understand and see a blueprint, like literally just see almost the biofield. So pulses tell me about the health of the organ system, about the chi, the life force. Is it deficient? Is there too much energy, scattered energy in the body, from a lot of people that are affected by electromagnetic pollution? Also looking at the tongue. That's huge. What I can see, like if people have too much fungal overgrowth, or they have spleen chi deficiency and their gut integrity is not very high functioning, or a red tip, and their shen, their spirit is being undermined for a certain reason. And a lot of people, I see a lot of that. I see a lot of shen, and I see a lot of liver chi stagnation, which is causing a lot of disruption in terms of how the blood and the chi moves in the body.
So I know that there's such a thing as a classical homeopathic person that can tell you what your constitutional remedy is. Can you figure out what the constitutional weakness is by listening to the pulses or by feeling
Definitely.
the pulses?
Oh,
So what are you seeing? What are the patterns of health that you're seeing? You're seeing the deficiency of the liver chi. What else are you seeing?
I see a lot of liver chi stagnation,
And explain that to my
that really
listeners.
means, so the liver has a lot to do with the transport of blood throughout the whole body, and getting rid of toxins. So when there is chi, the life force in the body, due to oxygen utilization issues, due to toxicity, when it's stagnant, the pulse feels wired. It's a wiry, taut pulse.
Oh, like my pulse.
Yes, when we live the robust lives that we do, trying to get our messages out in the world, Ann Louise, I can remember. Yes,
It
yes.
affects the body temple. Yes, indeed.
Right. So you're not getting, the blood is not circulating to the extremities as well as it can. There could be, cold pattern that's happening. I mean, and depression happens with liver chi stagnation. It also affects our shen, our spirit, and also just that life force is just getting, like, it's constricted. We want it to flow, right? We want to reestablish flow in the body, and how energy moves, how the blood, how the life force moves to the body.
So what does it mean when you have a weak? Is it a kidney pulse that you also feel?
Yeah, kidney, I see a lot of kidney yin deficiency. These are people that live that are not necessarily sleeping well, or just go, go, go. The to-do list never ends. That can manifest in ear ringing, hear loss, sleep issues, heart.
So the ear ringing, which is so prevalent in this day and age, you're bringing up something which is so prevalent. I get questions about it all the time. The tinnitus is related to a kidney issue.
Very often, in
How
Chinese,
fascinating.
right? The kidneys rule the ears, and also the hair.
The
So
kidneys rule the ears, and I understand if you have well-shaped ears, you have the possibility of a long life.
this is true. There's a lot of things that can help me, but that more
You
than
are so smart, Robyn Benson. Go on.
oh, more than anything is like when I feel a pulse that it's so quiet. There's very little vitality. That is, those are alarms go off for me to think, oh my gosh, what is going on here? Maybe this person is not exercising, or is just so depleted or severely depressed. Their mitochondria is not producing energy efficiently. So that's one of the most important things in Chinese medicine, one of the three treasures, right? We really want to move qi, we want to move blood, and we want to improve one's shen, their spirit.
So, if you were to name your top 5 regenerative therapies, what would they be?
Without a doubt, platelet-rich plasma is incredible because we're harnessing our own biology, which then we inject that golden elixir into the face, into the scalp, into the sexual organs to help rejuvenate and to turn back the clock at least 10 years. Amazing shifts happen for people in terms of ending incontinence, ending erectile dysfunction, helping people choose, without going under the knife, a way that they can actually resolve some of those aging concerns when we look in the mirror and want to feel good. So that's one. I'm a huge ozone woman, as are you. So we do ultraviolet blood irradiation, and we do the 10-pass ozone therapy. So for people with acute and chronic conditions that are like, some of our cancer patients that are cut open and they're not healing, that is like the best thing out there, in my opinion, to help people with really severe conditions like that. So ozone is really, really great. And injecting knees with ozone, prolozone, is fantastic. Another one is I'm really big into fast mimicking diet or some type of intermittent fasting. I think it's really important that we give our digestive system
a rest, a
rest.
vacation.
Yes. And then another one is I think IV nutrient therapy is really excellent. There's so many things. Getting a Myers cocktail, B12, vitamin C drips for some of our cancer patients that are, where we work synergistically. We try to work together with their oncologist to say, this is really helpful because we want to protect the body from some of the insults of some of the choices that people have to make. Herbal medicine is also really very, very helpful. So those are, hormones. Yes, that's another huge one. When people come in with really low testosterone.
And how do you assess that?
How do I like the 4-point urine test is my favorite from Meridian Valley. That's one of my favorite. And then if people also have blood work, we look at both, and then a questionnaire can often tell me what's deficient in someone's body. So we're looking at the main sex hormones, but the thing that I like about Meridian Valley is we're also looking at oxytocin. We're looking at
yes,
yes,
that's Dr. Jonathan Wright's lab, if I'm not mistaken.
Yes, and we're also looking at melatonin. Having too much or too little melatonin. So it's just very comprehensive, and I really like that. And obviously, if some people are on bioidentical hormones, it's a little bit more challenging to assess the accuracy because it's going to generally be elevated. But at least we get to see estrone, right? We don't want too much estrone in someone's body because that can convert, and seeing how you're down regulating your estrone in a more favorable pathway that's not cancer promoting. So in looking at estrogen dominance and how that plays out in the body as well.
So do you see a lot of need for sexual rejuvenation among your patients?
Oh my gosh. and was
Is that a big deal?
it's a huge deal. It's huge. Like 40% of 40-year-old men, 50% of 50-year-old men, and on up. I mean, and then honestly, I see just as many 20 and 30-year-olds. And a lot of that has to do more with pornography.
Well, explain that a little bit to my listeners.
Well, so porn is one of the most addictive choices an individual can make in their lives, because it affects your it's a neurogenesis pathway, that the only way that people can have sexual connection and feeling with a live being is through pornography, or it doesn't happen at all, because when the body is right there, they shut down, because it's not the same neuroactivity that's happening in the brain when they see when they're addicted to porn. It's a huge epidemic. Oh my goodness. And so
I'm so naive, I don't even realize this thing is happening. You see it among people of a certain age.
Oh yeah, especially this younger generation that have grown up with technology, right? And it's even worse in this pandemic time, so to speak.
Now I see.
Yeah, they're in front of computers all day long, and you go to college campuses like I have, educating people on electromagnetic pollution, and they put the laptops on their lap, and that is also affecting sexual energy. And gosh, it's one of my biggest concerns when I think about the health of this of humanity, is that the sperm count is going down exponentially.
Yes.
So, for many reasons. So sexual rejuvenation is a big deal.
And tell us how we rejuvenate. I mean, is it different if you're 40, 50, 60, or 70?
Absolutely. I like to know one's hormonal profile. I think that's very important.
And you do this through the Meridian Valley.
Yes. And or if people don't want to spend another $350 to do that, I look at their blood work, or just a simple quiz will help guide me, or just listening to my patients and really hearing what's going on. So we want to optimize hormones, and we also do that through Chinese herbs, which is great. But a lot of like men, if they come in here with they're pre-diabetic, or they're have type 2 diabetes, then not diabetic, we want to look at everything that lifestyle wise, because sexual function has obviously a lot to do with our nitric oxide production, healthy circulation. Once you introduce inflammation through blood sugar issues and through eating a crappy diet, that completely affects erectile function. And for women, for that matter, too, just the health of their vaginal tissue, the vitality, proper blood circulation. So we always have to look at, again, those foundational possibilities that's affecting men and women in terms of their sexual function. But it's a very important part of, like, we are both, we are champions for like, I love your radical longevity message in your book that's coming out very soon. Yay, I love it. Thank you. Thank you for your...
You're right. I wish that we had known about your Santa Fe Soul Center. You mentioned prominently in the book. I just uncovered and discovered you. You're like a little treasure chest.
Oh, thank you. So yes, I mean, it's sexual energy. When we think about how energy moves up in terms of our endocrine system, from our thyroid to our adrenals to our pineal gland, which is so important. Sexual energy it's trapped. That's when you don't use it, you lose it. It affects your sense of joy. It affects your sexual energy is really good for your brain, for healthy rest. So whether a person's with a partner or not, it is something to cultivate throughout your entire life. And I love that you address this as well.
So the question is, if somebody needs nitric oxide and has an issue with beets, what do you do for that? L-arginine?
L-arginine and citrulline are really helpful. And there's the Damiana, Tribulus, there's other...
yes, I write about some of that, but I love the L-arginine. I just think that cleans up the arteries as well.
It does. For sure. And getting people exercising again is really important, and getting those inflammatory foods removed.
And so Where does Chinese medicine fit into all this? In other words, do you eat according to the seasons and so forth?
I think that's very, very helpful. But what I love about Chinese medicine is that we don't have like 30,000 different diseases, right? We have patterns. You're looking at, oh, if just someone has excess phlegm in their body, which often I can determine by looking at their tongue and feeling a rolling quality in their pulse. So you never treat two people alike, right? So their body is telling me what's going on. So we look at what are those excesses and deficiencies. Is it a kidney pattern? Is it heart? Is it all of the above, right? A lot of times people have so much going on, but we focus on what's really overt. And in Chinese medicine, we always want to get to the root cause. And you always look at the emotional pattern. That's something very unique to Chinese medicine, which is the oldest continuous form of medicine on the planet. Maybe shamanism is a little bit older, but we're not separate from our emotional body. And I believe that that's most of why we get in trouble in the first place, is how we process emotions.
Yes, and unhealed childhood traumas and so forth.
Yeah.
So if we talk about traumas and we talk about emotions, the heart is connected with anger, or that's the liver.
That's right.
What emotion is harbored in the heart? Hate?
Well, yeah, that is
Lack of love.
I love the non-dual therapies, right? That's what is hate. It's contracted love. So, heart is all about the heart. Liver is how we're processing anger. The gallbladder has to do with indecision.
Gallbladder is indecision. There's so much gallbladder dysfunction.
Right. And liver, why there's so much liver tree stagnation, because we're trying to control everything, right?
Oh, yes, I know that one.
I love that acronym, for control, constantly orchestrating nothing through the restriction of love. So there's that liver heart connection.
Beautiful. And tell me about the intestines.
So that's literally about how we're processing. How do we process our emotions, right? Like it's how are we breaking things down? So it's the master of elimination in the body. So that's also why we see, it's an epidemic of gastrointestinal issues right now, from SIBO to parasites. Lots of different challenges where people are literally not nourishing themselves with the proper foods and giving themselves breaks between meals, and eating too late at night. All of that disrupts proper digestion.
And what about the spleen? What does that relate to?
Spleen has to do with that also has to do with the emotional body. And it's also so important for the spleen connection with the digestive system. It's very important for like blood, the health of the blood. Very important.
So when you use pulsed electromagnetic field therapy, is that like a beamer type mat that you have people lay on? Tell me what that's about.
We use one called IMRS, Intelligent Magnetic Resonance Stimulation. So when John Gray, our mutual friend, came here, he was part of my nonprofit that I had many years ago called the Santa Fe Soul Foundation. He told me about PMF. He's like, Robyn, he told this to like 800, 900 people in a sold out audience in downtown Santa Fe, that Dr. Benson has to get this PMF mat because it is so important for the health of every single cell in your body. It basically mimics nature. And so over the years, I have like one on every single table. So when we're doing acupuncture, I'm doing IV therapies, or regenerative medicine, doing injections, prolozones. I love to have the body already upgraded, right? So we can see this with PMF. You can actually look at the health of the red blood cells when they're stacked together. That's inflammation. You're not getting the nutrients in your cell or water very well, and you're not detoxing. So after 8 minutes being on this mat, it literally helps those red blood cells to separate. So it's like a raisin to grape situation, right? Raisins kind of, there's not a lot of vitality in a dried out raisin. That's what happens with our cells are aging, and they're not getting the nourishment that they need in that healthy magnetic field. And then it helps to detox as well. So it's good for pain, good for inflammation, helps people sleep. It helps to reset the parasympathetic parasympathetic and sympathetic nervous system. That's essential because a lot of people are just running their sympathetic to the ground. They're masculine, which in Chinese medicine, it's that yang principle. In Chinese medicine, it's all about the body. All it ever wants is to get back into balance. That's where we thrive when that's where we regenerate.
It's so hard in this day and age. It's so very
Right.
hard. It's so
Yeah.
very hard. So I also wanted to ask you, people come in to see you. How many practitioners do you have at your center?
We have about 5 practitioners.
And tell me what their specialties are.
So we have a couple doctors of Oriental medicine here, and then we also have somebody, Monty, who specializes in all of the energy medicine. That's the alpha omega scan.
Tell me about that alpha omega scan. Is that the one from Russia that you mentioned?
It is. It's designed by Russian, Austrian, and German scientists and medical people who are letting the world know that rather than focusing, or the ultimate focus is not on the biology and chemistry of the body, it's the biofield. What's happening in your biofield.
And what is happening as a general pattern? What are you seeing?
Well, we do see how the emotional body affects the biofield, but also reading the newspaper, how the blood, the quality of the blood is affected, what kind of parasites, what kind of environmental factors are getting in the way of the biofield. And the GDV machine, that one that's also from Russia, we work with the Tesla lights, which is pretty cool because you can look at the whole auric field of the body. And the biofield, you can actually see gaps, like in the thyroid, if someone has a thyroid issue, or someone who's had surgery. And we're big on treating scars here, but when there's scars in various parts of the body, that's an interference field that affects the biofield in terms of how energy is circulated.
How do you treat the scars?
Oh my gosh. I inject them with PRP, platelet-rich plasma. Like every single woman, I did 2 O shots this morning. This is for women for sexual rejuvenation. And if they have a C-section scar that goes over all those really important meridians, I inject it with a little bit of PRP followed by ozone. And I just thread it through the scar with the PRP. And then I add ozone. And then I go to the next part of the scar. Maybe it's 2 or 3 different times, but that it helps to break up the adhesions. Because very often when it's a C-section scar, or let's say someone has a hernia or has had any type of open heart surgery, that scar tissue affects the biofield. So people who've had hip replacements and they come in, or women who've had lumpectomies. I mean, I can't tell you how, like every week I'm injecting some of these scars, because women, when the weather changes or they can't sleep or it gets really tight, and just injecting it once or twice with ozone or a little bit of procaine, a little bit of saline, it's just liberating. It's liberating. Sometimes people can have, let's say, really excessive pain in their jaw, and they don't know it's from having a shoulder surgery. So this is what's brilliant about Chinese medicine, is everything affects everything. I mean, we're one unit. So rather than focusing on one area, we look at where the whole meridian pathway of, let's say, the heart meridian or the gallbladder, and we see the interrelated possible health challenges that are happening in that whole network of our body.
So you really represent future medicine today. You really do. You're futuristic, but you offer all these wonderful regenerative medicine treatments and assists and diagnostic procedures. So tell me about your success stories.
Oh, goodness. Okay. So in terms of sexual rejuvenation, we have helped so many men get that back. I mean, when a man loses that is like everything goes down from there. So we've had men with peyronie's, which is a curvature, which is scar tissue.
Oh, yes.
Help break that down. We've helped people get to the root cause of their autoimmune disease. Maybe it's too much mercury or lead in their body. A lot of our patients come in with gastrointestinal issues. So we figure out if it's a parasite problem or it's an emotional pattern that's going on in your body. We flip babies with acupuncture. Dr. Christie's excellent at that, and helping people get pregnant that have, that just lost all hope. We also, I think the most important thing to me really is like to help people know that to tap into their own sovereignty. Like every single patient, yeah, we're in a pandemic, but you know what? It's so much more than that. It's you being responsible for your own health. We help people to take that power back, to not default to saying, I need this drug or this vaccine or whatever, to know that you have such power. You have this amazing human body that is bioidentical to the earth, right? And what's good for the earth is good for our body. When we just kind of get back to our origin story and we take care of this vessel, we shouldn't get sick in the first place. Really, truly. And
Very, very definitely.
yeah, so I'm huge on that. Like just simple things like make sure your vitamin D levels are over 70 or 80. That's, in terms of this virus, that's like 90% of the equation, in my opinion.
You got it.
Vitamin D, vitamin A is really important. Zinc, lysine. This is why we want to look at your blood work. We want to do some testing to see where you're deficient. We do this simple little drinking a little bit of zinc. If people drink that, and we do that, we have that little zinc bottle in every room. If it tastes like water, then you are deficient in zinc. Oh my gosh, 200 enzymatic things happen in your body that are zinc related. Same thing with magnesium. So that's it. Vitamin C too. We do not produce vitamin C in our body, so we need to get that through our diet for most, but also fortunately we can supplement it, and there's some really good choices out there.
Do you treat children as well as adults?
We do. We definitely do. Children are pretty easy. The number one thing I do for children is always do a food sensitivity test. And I feel like if we get their gut figured out, they're better. But Dr. Christie also specializes in working with children, and very often they're just in and out, right? Because they're young, their bodies are much more resilient. They haven't lived life on this planet as long, but they're also more vulnerable for other reasons, because it's a different time to be born in this world right now than it was when we were born, right? So I'm just really grateful to a lot of my colleagues out there that are educating parents on how vitally important it is. It's diet. I think most everything for children is getting their diet corrected and helping them have a healthy immune system. That's where I'm at with that. And not for parents to educate themselves on vaccine, because we're giving way too many vaccines to our children.
Yes.
They're fully developed.
Yes, I just interviewed a fellow, J.B. Hanley, that just wrote a book about that. Actually, it's 2 books. Mm-hmm. So I realized the overload on certain sensitive systems. So would you say that American medicine is going in the right direction these days?
American medicine,
yes, like conventional medicine. It's a loaded question.
Oh boy, I think that it needs some CPR.
It's in need of some CPR. And the other thing,
CPR, I feel like we're just heading into this. We're just even more so of just disease management. And fortunately, there's so many awakened medical doctors that are practicing functional integrative medicine, and lots of doctors of Oriental medicine and osteopathic doctors and naturopathic doctors who are really, just saying, okay, we can help you get to the root cause. We can help you to shift what's going on in your system, that we can reverse most any disease. It's possible. That's the promise of this time.
That's the jewel. That's the hidden jewel of this time, if you're looking in the right place. Do you also do a lot of work with musculoskeletal issues, and how do you know what the root cause of that is?
Oh, definitely. Well, I think that's an erosion process that's going on, right? It's a degeneration. We're on a mission to help as many people turn degeneration into regeneration by design, right? Regeneration by design. But musculoskeletal, it has to do with like the which you talk a lot about, the acid alkaline balance in the body, certain traumas in the system, how much inflammation you have when you have magnesium deficiency. We actually steal from our bones, right? Whatever it takes, the body will do. And that's why we get some of these arthritic patterns. So yeah, it doesn't have to be a disease of aging, right? If we take care of our vessels.
That's so true. Rejuvenation and restoration is now available for those of us in our 40s, 50s, 60s, and 70s. It's never too late. Don't you agree?
It's never too late. And we have to have a whole movement to getting outdoors as much as possible, right? There's nothing better for the health of our cellular beings than walking on the earth and getting in bodies of water and drinking healthy water that actually gets into our cells. And getting away from all the electromagnetic pollution, because especially now more than ever, we're spending the statistics, when I wrote my book on travel and health, oh my gosh. I mean, the amount of, even the healthiest of healthy people, right? I get my runners and my triathletes and they're like, oh, but I'm outside a lot. And I mean, I have people who could do to actually measure how much time are you actually outside in any given day. And in a 7-day period, it's usually less than 4 hours in a full week, right?
Oh my gosh.
Yeah.
It's less than 2 hours here in Idaho these days.
Yeah.
So I can well imagine. So how do people get in touch with you, Robyn Benson?
Let's see, 2 different places, but destinationregenerate.com. That's destinationregenerate.com. And Robyn Benson, that's ROBYN Benson.com/gift. And then you can learn about a lot of my regenerative therapies and really the 5 pathways that I think are so important that are for free, like earthing, getting outdoors, right? And drinking, like making sure you're hydrated properly, just exercise is medicine, food is medicine, transmuting and releasing trauma. I have to say, when I do my women's retreats, I feel like that is the biggest breakthrough of all.
You do one. Wait a minute. We can't end this conversation. Tell us about the women's retreat.
Just destinationregenerate.com/women. You'll find out about it. But this retreat I do, it's called The Art of Liberation.
When do you do this?
I do it twice a year. My next one is July 8th through the 10th. Excuse me, July 8th through the 10th. It's a small group of women. We're going deep into what is in the way of a liberated lifestyle. What's in the way of you waking with the morning with energy? What are those traumas that are still deep in your tissue that is affecting your ability to speak your truth? That's a big one. That's been one of my own journeys, is really being able to speak my truth without worrying, being a doctor these days, that you're going to say what you think. And it's sad, so sad what's happened to so many of my colleagues and people that have, their videos, their YouTube channels are being taken down. So anyway, this women's retreat is really about helping a woman completely to say yes to her sovereignty, to her soulful, powerful, passionate woman that she is, and to excavate anything that's getting in the way and to say yes.
Spoken like a true, fearless Leo lioness.
Yes.
So I want to thank you so much for being
here. Thank you.
I hope you come back. And of course, I'm going to see you in Santa Fe, God willing, this fall.
Woohoo! I look forward to that so much. Wow, it's so great to know you and all your amazing work in the world. And yes, we're gonna have fun. We're liberated women. We're gonna have a lot to share,
and we're gonna change the world together.
Ooh, we are doing that. Yes,
till 123.
You remember 123 exactly. That's what I'm feeling into. That's what I'm vibrating. It's all, as you talk about so well too, it's all about vibration, right? Keeping in those higher frequencies, not letting the small stuff eat you up, and never forgetting we are spiritual beings living this human life, and why not experience heaven on earth every day? It's a choice.
I love that. And on that note, I'm going to say thank you once again, Robyn Benson.
Thank
You're
you.
a treasure,
Love
a pleasure
you.
to know and to really recognize and honor your sovereignty. And I want to thank all my listeners for joining me yet once again on First Lady of Nutrition podcast. I'll see you next week. Be well, be safe. Shalom uvracha, everyone. Hi, everybody. I'm Ann Louise here with just one more thing. Thank you so much for being a fan of my work. And if you like this video, please check out all my other videos. Please subscribe to my channel and turn on notifications.